Welcome everyone. Here's another Did You Know segment from me, Chandra, here at CCO. Today's Did You Know is all about the CPC, the COC, and the CIC. Those are three of the credentials from Aapc. Those are three of the core credentials and ones that are really hot topics for discussion right now. We've gotten a lot of questions about, well, how are these three credentials different? Let's go through and take a look at how they're different. As we go through here, we're going to talk about how these credentials differ. Well, the biggest area that they differ in is what environment you're working in. Who are you coding for? Are you coding for the physician? Are you coding for the facility? If you're coding for the facility, what part of the facility? We'll talk about all those different pieces. And then what is the content difference on the exams? How does it differ? They differ by a number of things. The CPC and the COC use a little different code set than the CIC does. So your coding skills and the code sets you need to be familiar with are a little bit different. The payment methodologies that are used. Providers get paid a little differently than the facilities do, and the facilities get paid a little different inpatient than they do outpatient. So we'll talk through all of that. And there are different questions asked in each area that they're testing on the exam. By that I mean they may ask more questions on the CPC over CPT codes than they do on the COC. And we'll look at exactly how those differ as we look at the next few slides. So let's take a look. If we look at these credentials, I put together kind of a quick comparison tool. All of the information that's in this presentation was gleaned directly from the Aapc website. So if you go to their website and start looking at these credentials, which we're going to do here in a few minutes, you'll see it ties right back to these charts. The most common Aapc credential that held is the CPC. The CPC stands for the Certified Professional Coder. Aapc has over 105,000 members with that particular credential, which is awesome. There's that many of us out there. But when we start looking at the CPC, it is geared specifically to those individuals coding for physician work. So they're either working in a physician's office or they're doing billing and coding for a physician, covering all the areas that the physician works. Not just the office, but sometimes physicians see patients mainly in the office, but also perform procedures in a facility, whether it be a hospital, an ambulatory surgery center. And these coders oftentimes code the professional aspect, the aspect that the physicians do for those services. This exam, the CPC exam, is 150 multiple choice questions, and it breaks down into all of the areas that I have outlined on the slide. Right? We go through the different areas of CPT, it tests on medical terminology, anatomy, the different areas of ICD-10-CM. We're going to remember that ICD-10-CM is specifically for diagnosis coding. Remember, we also have ICD-10-PCS. That's for procedures, but CPCs don't use PCS. We're going to talk about where PCS comes in a minute. So the CPCs are tested primarily on CPT, ICD-10-CM, and HCPCS level 2, right? Those HCPCS codes, that small book, it's got codes for, supplies, drug codes, Medicare specific codes that our providers are performing. When we look at the CPC and we think of that kind of as our standard, our base credential, that's what most people go after first. Doesn't mean that you have to, it's just what most people do. Let's compare the COC to that first. Now, the COC has recently been renamed, just this last year. Last year, it was called the CPCH, and they renamed it to kind of get away from the dashes in the credentials and make everything a little more standardized. So they call it the COC. It is a Certified Outpatient Hospital Coder. So this is someone who is typically coding for the facility that the services are rendered in. And specifically, they work on the outpatient side of the hospital. So those same-day surgeries, emergency room departments, those types of things. May also include outpatient therapies, lab departments, pathology departments, things where the patient's not usually admitted to stay overnight, but they're services that the facility is providing. So this is where we're capturing a lot of the Room and board charges, the overhead, and the billing is a little bit different than the CPC. For the most part, the services are reported exactly the same way. They're also reported on a CMS 1500. And when we talk about claim forms, the CMS 1500 is what the professional side uses and what the hospital outpatient department uses. Interestingly enough, when we look at some of the guidelines for ICD-10-CM, you'll notice that they split them kind of as professional and hospital outpatient or completely inpatient. And that's kind of what these credentials are doing as well. We have the CPC just for the professional component. We have the COC for those that work in the hospital outpatient side of things. And you'll notice that when we compare the outpatient to the professional services, the areas of study don't change a whole lot. What changes is where do we ask, how many questions do we ask in which areas? We have surgical cases. They say that there are 40 questions on surgical cases. Those may be CPT or HCPCS, but for the most part, they replace the 60 questions that are asked on the CPC about CPT, right? CPT sections 10000 through 60000, or as we like to call them, the 10,000 series through the 60,000 series. Those are all for procedures that are performed. Well, we simply take those 60 questions and replace them with 40 questions. And everybody's probably like, well, why do we ask so many less? Well, as we start to look through here, a hospital outpatient coder needs to know a little bit more information, a little bit different information than a professional coder or a CPC coder. And specifically in this little graph, what you'll notice is I've kind of put different shades of green to represent different things. This real pale green simply shows you those are areas where the number of questions are less on the COC than they are on the CPC. This middle color of green, kind of that middle shade of green, tells you the same areas are being tested, but now we are asking a few more questions on the COC than we did on the CPC. This bright green area down here at the bottom, the really dark one, that's a brand new area. There are no questions on the CPC about payment methodology. Because when we are a CPC, usually, yes, we understand the billing side of things, and oftentimes we wind up working the claim denials and all of that. But we're used to fee for service, right? We're used to getting paid on a fee schedule and all of that. When you start talking about the hospital inpatient, there are some different payment methods that those hospitals may get paid under, and sometimes it depends on which department you're working for. If you're working for an emergency department, they may fall under a different payment than the hospital outpatient surgery center. So they ask you some questions about the payment methodology. We're going to delve a little bit deeper into each of these credentials in the next slide, okay? But high level, so we know the CPC is the professional, the COC is the hospital outpatient side of things. They're very similar in what they test, the main difference being there's a new section for payment methodology under COC. Well, let's throw this CIC in there and see what this does to us. The CIC stands for the Certified Hospital Inpatient Coder. Now, when we talk about inpatient, there's a lot of misinformation out there or even confused information out there. When we talk about inpatient, typically we're talking about billing for the facility, the actual hospital billing for services that were provided to a patient during a hospital admission. So they were admitted, they stayed overnight, maybe they stayed a few nights. And we are the facility billing for this. Now, the physician can also bill for the services they rendered during the inpatient stay. But that falls under professional. Remember, professional equals physician, right? We're billing for the physician, the nurse practitioner, those qualified individuals that can bill on their own. That's over there. When we talk about hospital inpatient, we're talking about, all right, we're trying to get the money for the hospital. We're trying to get the money for all of the things that the hospital made available to this patient, right? The room, the bed, the lights, the operating room, all of the equipment, the nursing services, like, right, your RNs that come in and see the patient and make sure that everything's going okay and execute that plan of care that the physician outlines for here's what I need you to do until I come back and see the patient the next time. All of those fall under this CIC, this hospital inpatient. And you'll notice that it's significantly different from the first two credentials we talked about. The biggest area that you see a big difference is when we talk about comparing it to those two exams. Those two exams are very heavily weighted. The CPC and the COC are very heavily weighted on CPT codes, right? Because that's what we use to say we performed surgery. These are our surgical codes. Well, on the CIC, there are no CPT codes. So some of you are probably going, well, wait a minute. How do we tell what we did? Well, in this case, they actually moved it down here to the bottom, and they call it coding cases, and you code them using the ICD-10 CM codes for diagnosis and the ICD-10 PCS codes. The ICD-10 PCS is the procedural coding system, and it is used only by inpatient facilities to report the same services that physicians would report with a CPT code. And they're a very different structure, and they're a different way of reporting the codes. So when we look at the CIC, it's drastically different from the CPC and the COC. The CPC and the COC, the first two we talked about, both have 150 questions. They're both multiple choice completely, 100%. All of the questions on it are multiple choice questions. The CIC, not only does it cover different content, not include any CPT codes, that sort of thing, but now we have 60 multiple choice questions, and then they have these 10 coding cases at the end of it that are fill in the blank. You have to assign the codes for that case. There are 10 fill in the blank cases, those coding cases where you have to assign codes. When we asked Aapc about those, they tell us there's about 110 codes that you need across those 10 cases. So one case might have 10 or 12 codes required. Another case might only need 8. They do tell you on the coding cases how many codes are needed per case and how many are diagnosis versus procedure. But they're not multiple choice. So that makes that exam inherently a little bit more difficult because you're not picking from a select number of options. You now actually have to find the code. You'll notice the rest of the areas are very, very similar concepts to the CPC and the COC. They ask you about medical terminology, anatomy. They ask you about ICD-10 CM coding, right? Your inpatient coding. They ask you about compliance. They ask you about payer and regulatory requirements. They ask you about payment methodologies, just like the COC added those 20 questions. Well, on the CIC, there's only 18 questions, but now they divide it into two different categories. We want to ask you about both inpatient and outpatient. Now, a lot of people are going, wait a minute, this is an inpatient exam. Why are they asking me about outpatient? Well, oftentimes, if you work in a hospital inpatient environment, there are times that you have to look at records for a patient who started outpatient and became an inpatient. And sometimes, if there's a backlog, you've got to help code those outpatient hospital cases. So you really need to have an understanding of both. And that's what they're doing with those 5 payment methodology questions. They're asking you if you know the difference in how the facility gets paid for the inpatient versus the outpatient. We'll look at the specific concepts that they have in each of these buckets in another slide or two. The 2 new areas they ask about on the CIC, well, we've got those 10 coding cases. Not that that's really new because it's still coding information, but this is where we're adding in PCS codes for the first time, and they're no longer multiple choice. So that's a big difference. The other area that's a little different, on the other exams, they ask about coding guidelines. On the CIC, they ask about medical record and healthcare documentation guidelines. So not just do you need to know the coding guidelines to assign the codes correctly when you get to the cases, but now they want to make sure that you know all of the rules around medical records and medical record documentation. Do you know how a proper correction to a record is done? What style does that have to look like? Are they allowed to white out? Are they allowed to scribble through? The answer to both of those is no. But they ask you those types of things. How long does a physician have to make a correction to a record or to add information to a record after the patient was seen? So those are the types of questions they're going to ask you there. High-level overview. When we compare the CPC, the COC, and the CIC, biggest difference. Where are you working, right? That work environment. Are you working for a physician? Are you working for a facility? If you're working for a facility, are you working on the outpatient side or are you working on the inpatient side? Biggest differences. Second biggest difference, which code sets do you use? Because both the CPC and the COC, you need to know CPT, HCPCS, and ICD-10-CM. The CIC, you have to know ICD-10-CM and ICD-10-PCS, right? None of the CPT codes. So let's take a look at each of these individually. Let's talk a minute about the CPC. This information, again, came right from the Aapc website. We're going to go to that site in just a second. But the Aapc says that certified CPCs need to be able to demonstrate the following. So they have expertise in reviewing and assigning accurate medical codes for diagnosis, procedures, and services performed by physicians and other qualified healthcare providers in the office or in the facility setting. So right there, they tell you, you are working for a healthcare provider. You are coding for a healthcare provider if you are a CPC. And you may have to code a number of things: E&M, anesthesia, surgery, radiology, pathology, medicine. Any of those different things are included. You have to know your coding guidelines. You've got to know your compliance and reimbursement guidelines so that you know how to identify medical necessity issues, claims denial issues, bundling issues, charge capture problems, all of that. And you're really there to help ensure that your provider gets proper payment for the services provided. That's what the CPC is all about. If we go to this link right down here on the bottom, this is the Aapc website, and it's a direct link to what you need to know about the CPC certification. The reason I included this link, we're going to go to this part of the slide, or this part of the site, because while I break down how many questions they ask here, some people want a little bit more information, right? What exactly is included in the HCPCS Level 2? Those 5 questions, what do I need to know? Those types of things. So let's take a look at that website. So if we go directly to the aapc.com/certification/CPC, it automatically adds this remainder string of text up there. So don't worry about that. Just focus on that. I want the Aapc website, I want certifications, and the CPC. So if you look here, this is where they begin to tell you, this is kind of our gold standard. We have over 105,000 certified, that sort of thing. There's going to be more opportunity in this area, according to the Bureau of Labor Statistics, as we move forward. Right here is where I said, okay, you've got to have demonstrated these things. Looked a lot bigger on my slide, didn't it? But they're telling you right here, these are the things you need to know. Now, they go on to say the CPC, right? This is the Certified Professional Coder. You're coding for a physician or a qualified healthcare provider. It's 150 multiple choice questions. You get 5 hours and 40 minutes to take it. It includes one free retake. So if you don't pass the first time, we're going to add a second retake for free and you can retake it. The fee is $350 to register or $290 if you are a student enrolled in an Aapc curriculum program. It is open book. By open book, they mean you can use your CPT manual, your ICD-10-CM manual, and your HCPCS manual to take this. Right down here is where you'll notice this matches up to that table that I had, right? There's questions on the 10,000, 20,000, 30, and so forth and so on, all the way through. Well, these are actually all expandable. So if I click, for example, all right, I want to know what they're going to ask me about HCPCS Level 2. When I click on it, they say, we're going to ask you 5 questions on HCPCS Level 2. It could be anything from modifiers, supplies, medications, professional services for Medicare patients. These are the topics that we're going to ask you about in those 5 questions. Now, you have to know the difference here. You have to know that when they say modifiers for HCPCS, that's not the same thing as your CPT modifiers. That's not usually your 25 and your 57 and your 59, but instead for the HCPCS modifiers, these are the ones where you say, oh, well, maybe it was their left toe that got hurt, or maybe you want to identify that it was a certified registered nurse anesthetist that helped provide the service with the anesthesiologist. Those types of modifiers, and those are in your HCPCS book back in one of the appendices. Supplies could be medications. Oftentimes those are your J codes, right? I'm sorry, when we say supplies, that is usually like casting, strapping, splinting, any kind of prosthetics, orthotics, those types of things, slings. Medications, oftentimes those are your J codes. J codes are for drugs that are administered, right? Maybe we gave the patient a Kenalog injection while they're here, or maybe we gave them a Depo-Medrol injection. Professional services for Medicare patients. There are some services that we could report with a CPT code, but Medicare's created their own G code, right? They've got G codes for their initial preventive physical exams, their annual wellness visits, certain vaccinations. If a Medicare patient receives a pneumonia vaccine, there's a G code for that. Those are the types of things they're asking for here. So if you go through each of these, it'll kind of outline for you, here are the types of questions we're going to ask you. We're going to ask you 6 questions on coding guidelines. Could be over any of these types of topics. So those are the things that you want to go out there and be familiar with and know, oh, okay, for the CPC, here are the types of questions they're going to ask me. So we've looked a little bit at the CPC, and we've covered kind of where that fits in. Let's talk a minute about the COC. Now notice here, right up front, they tell you this is a coder who is working in the outpatient facility or hospital service side of things. Tell you right up front. And these are, you're going to be reporting diagnoses, procedures, and services done in the outpatient setting. Could be an emergency room visit, an outpatient clinic, a same-day surgery, diagnostic testing, including lab and radiology, outpatient therapies, PT, OT, speech therapy, chemotherapy. All of those are typically done in an outpatient setting. So those are the areas and the types of procedures you're going to see. You're not going to see things like, oh, let's see, what is something that takes a while for you to do, right? What's something that you're going to be in the hospital for long term? Well, you're not going to see things like kidney transplants. I'm not going to transplant a patient's kidney and send them home same day. That's not how this works. These are where, just as they say here, right? Emergency department visits, outpatient clinic visit. Maybe the patient came in for a same-day surgery. So think more, they're still major surgeries, but less invasive to the patient. So something that we didn't really have to cut them open and go digging around. This could be like a laparoscopic appendectomy. We poked a couple holes, stuck the tools in, took their appendix out, and we're going to let them recover for a few hours, and then we're going to send them home. Okay, but those are the types of things that they're going to ask you. They still want you to understand medical necessity, claims denial, bundling issues, charge capture, all of that. But now they're going to ask you a few additional questions on things that you have to know for the facility, you don't have to know for a provider. Things like, what's a charge description master? Or a charge master is what most of us know it called as. How is that updated? What goes on a UBO4? Because outpatient services oftentimes are on a UBO4 unless you're billing for an ambulatory surgery center or even some emergency department visits, and those go out on a CMS 1500. So you've got to know both claim forms. You've got to understand both of those. Again, if you follow the link down here at the bottom of the screen, go to the aapc.com/certification/COC, it'll give you a breakdown of these categories I've listed over here on the left once again. So if we go, let's take a look at the outpatient credential. So the COC, same thing, gives you the same bullets. Here's everything that we're going to expect you to understand. Again, 150 multiple choice questions, 5 hours and 40 minutes to finish the exam, 1 retake, $350 to register unless you're an Aapc curriculum student, and you get $290 registration fee. You can use your open code books. So again, your ICD-10 CM, your CPT, and your HCPCS book. Again, it'll break down, here's exactly what we're talking about. So if we say, all right, when they say payment methodologies, what are they going to ask me? Well, they're going to ask you 20 questions. I love it. They're going to play 20 questions with you, right? They're going to ask you anything in these categories. So do you know the different parts of Medicare, A, B, C, and D, and which is covered under each? When can Medicare be a secondary payer? Because sometimes Medicare is secondary to other insurance, but there's specific circumstances. How do you complete a claim form, whether it be a UBO4 or a CMS 1500? They can ask you anything about either of those. Usually they're fairly basic questions, but they could ask you about either of them. Do you understand the outpatient prospective payment system payment methodology? What are APCs, or ambulatory payment classifications? Do you understand how a revenue code works and what it represents? What are status indicators versus payment indicators? Do you know what a condition code does? How do we calculate payment? Now, they're not usually going to ask you to calculate a payment. Like, you don't have to take a calculator with you and do some extensive math. But they want you to understand what basic services determine this is going to be paid more than this one, or these two things can't be billed together, that sort of thing. They will and could potentially ask you about some of the inpatient payment methodology. A lot of people ask me, this is an outpatient exam, why are they asking me about inpatient payment? Same reason I gave earlier for they do the same thing in reverse on the inpatient credential, right? If you work in a hospital facility, even if you're an outpatient coder, you need to know what happens if you have a patient that's supposed to be yours, that's outpatient, and something happens and they convert to be an inpatient. Because depending on the facility you're in, you may have to code that, or you may have to send it over to the inpatient coder to assign the appropriate documentation or appropriate codes based on the documentation. But it really just depends. So you've got to at least understand there is some difference, and that's what they're trying to make sure you know there. So we talked about the CPC, we talked about the COC. Let's take a look at the CIC before we wrap up. The CIC, now remember, this is your inpatient facility. They tell you right up front, you're here to support accurate inpatient coding. You're coding for the inpatient setting. Typically, this is the facility, and this is where we get into things like MS-DRGs and the Inpatient Prospective Payment System, or IPPS. You have to know some of the same things that you had to know for the COC, right? You have to know how to assign diagnosis codes. You have to know what a charge master is, how UBO4 is completed, and the payment methodologies for outpatient. But let's look a little bit more specifically and see how this one differs from the other two we've talked about. If we look at the CIC, right? The CIC, again, this is an inpatient certification, and this is inpatient hospital or facility coding. Tells you right up here at the very top. You have to understand ICD-10-CM and ICD-10-PCS coding. No CPT, no HCPCS. Those two books are not allowed for this exam. You only get your ICD-10-CM and your ICD-10-PCS. As you scroll down a little bit further, it tells you here there are 60 multiple choice questions, and here's where it differs. Instead of being all multiple choice, now we have 10 inpatients that are fill in the blank. And that's where I said across those 10 patients, you've got on average 110 codes that may need to be assigned. 5 hours and 40 minutes, so same time frame. One free retake is still included. Same registration costs, right? $350 unless you're an Aapc curriculum student, and you get $290 registration fee. You do get to use your open book manuals, but now you have a different set of manuals. You only get your ICD-10-CM and your ICD-10-PCS. Now if you come down here, the same thing. As we click on these, okay, well, what are they going to ask me? They've split payment methodology into two things. What do I need to know? Well, on the inpatient, they say, okay, we're going to ask you 13 questions. And it could be over any of these included things here. We could ask you about the 2 midnight rule. We could ask you if you understand different bill types. Yes, there are different bill types in the inpatient environment. Do you understand how to calculate a DRG? Now, this is one that I find most people, even if they work in the hospital, don't understand, because most hospital systems automatically calculate the DRG for them. But you need to understand, again, they're not going to ask you usually to calculate the DRG, but they want you to understand what makes what would bump a patient from one DRG to the next. What types of things impact that? So things like, what chronic conditions do they have? Did they have a major surgery while they were here? What was their disposition when they left, right? Did we discharge them? Did we move them to another facility? Or did they expire while they were in our facility? You've got to know the different types of DRGs, because there are different types depending on which facility you're in, whether it's a hospital or whether it's an inpatient psychiatric unit, those types of things. The thing I want to show for sure down here at the bottom are these coding cases. They are 10 fill in the blank Remember, we said an average of 110 codes total across those 10. And you have to assign both the ICD-10-CM codes and the ICD-10 PCS codes. So you have to understand PCS. If you've never looked at PCS, don't go in there thinking you're going to just pick it up like this. There's a learning curve to PCS. Once you understand kind of the concepts behind it, it becomes a lot easier to pick up, and most people really like it, but there is definitely a learning curve with that. So let's go back and recap real quick. The CPC, the COC, and the CIC are each different in a number of ways, right? CPC, physician, is who you're coding for. COC, you're coding for the outpatient facility. CIC, you're coding for the inpatient facility. And they cover many of the same topics, right? They all cover anatomy. They all cover medical terminology. They all include diagnosis coding. But they differ in, right? The CPC and the COC, you use CPT and HCPCS. The CIC, you use ICD-10 PCS instead. Make sure that you do some research on which credentials you think you want to pursue. Go out there and look and read about them and figure out how they're different and figure out which things you like and which things you don't like. That'll help you determine which credential is right for you. Yes, the CPC is the one that most people go after first, and it's very, very well recognized. That doesn't mean it's the one you have to go to first. It's just sometimes it's the easiest one for people to learn and then build on that knowledge for those other areas, right? I see a lot of people get the CPC first, and then they look and they go, oh, well, the outpatient, the COC, is only different by 20 questions. Maybe I'll go for that as my second credential, right? And then they build their way up. Some people work exclusively in the inpatient environment, and they're like, I understand ICD-10-CM and PCS. I don't know anything about CPT. I'm going to stick over here in the CIC. If you understand the differences between the different credentials, that'll help you select which one is right for you, right? Remember that when you look at these credentials, anything is possible if you're willing to put in the time and the effort to learn these, right? To go through a program, to really self-study. Make sure that you know and understand all the different things and never be afraid to ask a question. You can do anything as long as you put your mind to it. Hopefully this has helped kind of answer the questions that you've had on the differences between the CPC, the COC, and the CIC. I hope you have enjoyed it, and I hope it taught you a thing or two, and I hope to see you back on a future recording with us. Have a great day, and happy coding.